Hello, it's Bill, the Knee Pain Guru. Today is Monday, November 29th, 2021. And we are back. And today we're going to talk about, what are we talking about? Does deep laser therapy help with scar tissue? Okay, this is a good question. Let's see. Does deep laser therapy? And just so we're all on the same page, okay, so there's a little bit of information here on deep laser therapy, specific types, and they're essentially forcing this light into the area where the scar tissue, um, based on what the initial purview of what's going on the internet, it is helpful. Now, personally, after my surgery, the scar, I had staples that held together my scar. I had both internal sutures as well as external staples for the ACL reconstruction that they did on my knee. So I have about a, what is it, 5, 6, 7-inch scar on my left knee. Now there's no scar tissue in there anymore. It's broken down. It's just like regular skin. You can tell where the scar is, but scar tissue is not there anymore. And there was a period of time where I did use a laser. I have not gone into a lot of research on the different types of lasers, because you have different intensity, you have different frequency, you have different types of lasers that you can use on the scar tissue to break down scar tissue. Once again, I used it myself. Personally, I didn't notice any difference. I was moving the laser over the area where the scar was. There was no, I didn't notice any feeling of difference, like reducing any sort of pain or tension in the area. I didn't notice anything as far as uh, uh, increased range of motion or anything like that. Now, that's my own personal subjective experience. I didn't use it a whole lot. However, I did use it. I don't necessarily know that I have anything to report from my own personal experience, pro or con. It looks like the initial Google search or internet search on the deep tissue laser therapy looks like it can be very beneficial. I have a friend of mine who's a doctor, and he was using a specific type of laser that was going in and essentially warming up the small amount of liquid or water that is in the scar tissue that allows the scar tissue to break down and be more malleable, because scar tissue tends to get real tight, real knotty, and there's lots of layers to what's going on in there, as it's your body's mechanism, like a band-aid that protects what was cut or injured in your knee or other parts of your body as far as scar tissue goes. If this is making sense, give the video a thumbs up, like and subscribe to the channel. If you have your own personal experience of laser therapy to break down scar tissue in your knee, please enter that in below. And specifically, if you had any experience about deep tissue laser therapy, which there's a specific trademark around that name, if you've had any experience with that, please enter that in below as well. Now, what's important to look at when approaching scar tissue, and this is like, the question is good, and the question came in from Pam, who says, does deep laser therapy help with scar tissue and movement after total knee replacement? when you're looking at, we can make the assumption, or we can make a false assumption, that the reason that the range of motion is not coming back in the knee is because of the scar tissue. We can point to it and we can work on resolving the scar tissue, which may or may not be the case. And what's important to look at is that the structure of your leg, the structure of your body is in a place that allows for the limiting factor to be the scar tissue. Meaning, Pam could be starting the conversation or making the assumption that the reason why the range of motion is being restricted after the total knee replacement is due to the scar tissue, when in actuality, we could have other restrictions going on in the knee, the alignment of what's going on in the knee. We can look at what's going on in the heel, the ankle, the foot, that can actually restrict range of motion in the knee. We can look at what's going on in the hip and lower back that can be restricting what's going on in the knee. And then we could also look at the potential for the knee replacement to have been installed in a way that is restricting range of motion in the knee. So we have to look at other factors, like take a step back and look at other factors that may be contributing to the lack of range of motion in the knee, and not necessarily jump to the idea that the scar tissue is actually the reason why the range of motion is not happening in the knee. So what could happen, and this is what I see a lot in working with clients with knee pain, is they put a lot of effort into breaking down the scar tissue, thinking that by breaking down the scar tissue, they're going to get the range of motion, which is really what they want, or the pain reduction, which is really what they want. And what ends up happening is they may break down the scar tissue, but the pain is still there and they still have restricted range of motion. So once again, it's important to take just a moment and evaluate what you really want with your knee, and look at it from, without getting too deep into the diagnosis, what do you really want? Is it usually boils down to two things over the past 20 some years in working with clients. It's either pain or range of motion. And a lot of times the range of motion is dictated by the pain. So if we can reduce the pain or the neurological pattern that's going on in the knee that's restricting the range of motion, and we get that neurological signal different, whether it be solely in the knee, if we look at what's going on in the ankle or the foot, hamstring, quad, shin, calf, hip, lower back, and free those patterns up, then what can happen is the range of motion comes back, and we don't even have a conversation about scar tissue because the scar tissue was never the issue to begin with. Anyhow, just something to think about, something to consider when you're approaching what's going on with your knee, or any part of your body for that matter, if there's a restriction in range of motion, that we're wanting to address the source. Like what is going to make the biggest difference for your knee in the shortest period of time with the minimal time, energy, effort. And that's what is important to look at so you can get the results that you're looking for. If this is making sense, give the video a thumbs up, like and subscribe to the channel, Knee Pain Guru channel. Turn on notifications for future videos. If you would like to have some action steps, like an action step you can take right from watching this video, you can head on over to the kneepainguru.com website. I am offering you complimentary access to Knee Club. And what I have is basically it's group coaching program where I work with clients twice per week in a private Facebook group. There's a private Facebook group. It's a private Zoom call actually. And what I do is I work with them one by one, answer their questions to customize a program to get them out of pain. Now, the Knee Club membership, the complimentary knee club membership, is a LITE version of it, which is, you see me coaching, you see me working with clients, and there's some real gems that I'm sharing with them. However, what you don't have access to is asking me questions in that context, where I'm giving you the specific things to customize a program to get your knee out of pain, or access to the private Facebook group, or to the videos that I'm referring to during those calls. So you can get an understanding of how I work with clients to get them out of pain. You hear a lot of what they're experiencing, their struggles, their frustration, things like that, real in time working with those clients. So you can check that out, complimentary access to the knee club. So you can check that out at the kneepainguru.com website. All of that information is down below, where you can check that out. The links are there as well in the description box. Any questions? If you have questions, those are those that are watching through, let's see, Facebook and YouTube. If you have questions, please type those in the live chat or the comments section, and I'll be happy to address those questions. I'm also going to share with you a cool little video clip that tells a little bit more about Knee Club. But that is about it for today. I'm going to scoot. I have a few things to get done from here. But of course, if you're watching the replay, you have any questions, just type those in as well. This is Bill Paravano, the Knee Pain Guru. Thanking you so much for being here. Have a wonderful day, and check out this clip.